Hi everyone, how you doing? Today, let's look at how we plan an all-on-4 treatment. Okay, so those people who are not familiar with all-on-4, this is a treatment where we replace a full set of teeth with dental implants. Typically, we can do it in one day. And let's assume that we've had a consultation, myself and the patient, we've had a detailed conversation, it's typically about 2 hours. We've explored all of the options. We've taken a basic level x-ray, which kind of shows me where bone is. If we're going to need to look at more complicated zygomatic implants, or are we okay with standard implants, which we're okay with in today's case. Once we're sure we're ready to move ahead, we need a few additional records. Number one is a CBCT. This stands for a cone beam CT scan. And these are super common. Every implant dentist will be familiar with this. Either they have a scanner in-house or they have somewhere nearby who can take the scans. And this gives us a 3D visualization of what the bone is like. Okay, so if we go to my screen here, we can see that this is a CT scan. Okay, we've got these 3 or 5 different windows here with these 3 views, and you've got this kind of 3D mock-up of kind of where the teeth are. This is the least useful of all these windows, but we'll walk through this. You can see I've already placed all of these implants. I've placed them virtually, but we'll come back to this. But the CT scan is just one of the records that we need to take. The second is an impression or a digital scan, okay? And I've got no preference, okay? We get the same results whether we take a digital scan or whether we take an impression. Typically, we have one scanner between the different rooms, so it may be in use, or there may be technical issues. These are issues you never get with a classic impression, okay? But we need to somehow get a model of the teeth as they are. We then digitize this model, okay? And then we can pull it into our CT scan if we want to. We're not going to do that today because I don't need to do this with a normal all-on-4 treatment, okay? If we're going to use guided surgery, then yes, we definitely need to do this step. And our third record is a bite record. Okay, now bite record is a really, really important record, and sometimes we can do it at the time where we take the impressions, but sometimes the teeth are so loose or there's not enough teeth in contact that we're not able to take a bite record at that appointment. So we have a second appointment to do this. Now, when we look at a treatment like all-on-4, okay, the success and whether the treatment is successful is different depending on what point of view you take. Okay, so as a clinician, when I'm placing my implants, success is that we've placed the implant in good quality bone, we've got good healthy gum around all of these implants, we get 0 infection, and the implants last. From a patient's point of view, the success is, does it look good? Is it strong? Okay, so we have to, our goal is to make our patients happy, right? Is to tick all of the things which they have in their head, what they want to achieve. Our job is to help our patients achieve those goals. And things like, are the implants in good quality bone? That's almost a given. From a patient's point of view, you would completely expect that. So we're going to go behind the scenes. I'm going to show you how we plan for something like that. But first, let's look at the aesthetics. So this is the case that we've got here, okay? And this is the smile photo for this case. Now, you can immediately see that the gums have completely shrunk up. Okay, we've got tartar in between the teeth, but that's picked up staining. That's why it looks bad in between there. If we jump to a photo of the lower teeth, you can immediately see why this lady needed to have all-on-4 treatment. Okay, so a lot of these bottom teeth, they're all completely loose, and it makes it tricky to take an impression or a scan. Okay, if you imagine we take a mold of the teeth are going to move a little bit, and we need to make a denture out of this. Okay, we need to make a temporary denture, which we're going to convert into our temporary bridge. That's our goal. So again, let's go back to the aesthetics, because I do a lot of planning from a photo, something like this. And I'm looking at the look of the smile. So I want the bottom edge of the teeth here. I want that to follow the lower lip. You can see that these teeth are too long at the back. Okay, all these three teeth are too long. These front two teeth, okay, the length of them is really, really important to get right. Now here they look too long, and we have to decide, okay, are the teeth too long or has the gum shrunk up too much? Okay, so that what we call the incisal edge, which is the bottom edge of the front teeth, needs to be in exactly the right position, or as close as we can for the temporaries. So because at the end of the day, it's a bit of a guess. Okay, we're going to make these dentures, and the look of these dentures, we're not having an opportunity to try them in and make modifications. We have to commit. Okay, so there is some guesswork involved here. So that's my kind of incisal length. The next thing I try and judge is how much overlap. So here you can imagine that the bottom teeth are kind of finishing here somewhere. Okay, so this is the amount of overlap we have between the front teeth. Now, if we have a lot of overlap, that's absolutely fine. A lot of people do, but we tend to get more complications, okay, because of the biting forces and teeth chipping off and things like that. So we want to reduce that, that overlap. And typically we do it once we know where the top teeth are supposed to be, we then just shorten the lower teeth so that we've got maybe 1 millimeter or maybe 2 millimeters of overlap there. So we can see that what I've done is drawn on this photo to help my lab get the ideal position of the teeth, because they can look at this and they can say, okay, look, make these front teeth 1 or 2 millimeters shorter, make the side teeth, one of them looks absolutely fine, the other teeth need to be a little bit shorter. Okay, so they've got to kind of gauge where they are. The next thing, the midline. Okay, in this case we want to keep the midline in the same position. And from that point, we kind of use kind of average values to get the width of the teeth. We choose a color of the teeth, usually just a little bit lighter than the patient's natural teeth. And then when we make our final set, we can again modify the color a little bit. So that is how we look at the aesthetics of the teeth. We now need to think about the aesthetics of the gum here, okay? Because there is something called a transition line, which I cannot hide. Okay, the transition line is where the prosthetic, i.e. the fake teeth and gums start and where the natural gums stop. Okay, so here we've got the natural gum, but you can look, this is just the patient with her mouth open a little bit. Okay, we have to ask the patient to smile really wide, because right now, our patient hates the way they look. By the end of it, they'll really like the way that the teeth look. And if they smile wider because they're happy with the way everything looks, we want that transition line to be completely hidden. Okay, so quite often I'll take a photo of this, but sometimes it's difficult for our patients to smile that wide. Okay, so I'll kind of almost guess where that transition line should be. So when the patient was just smiling, we could see about this much gum. Okay, we can see if I take the gum up another 5 to 6 millimeters up here, we are going to be safe and clear of the transition line showing when the patient smiles really widely. Okay, so remember that we want to take it up 5 or 6 millimeters. When we look at a CT scan, that's going to be important. Now, you can probably guess from a photo like this that this patient hasn't got a very, what we call, stable bite. They probably bite in, several different positions depending on what hurts and what doesn't. And these are the situations where we need to look at recording the bite in a different appointment. Okay, so if you've ever had a denture made, there's a part of the process where we ask the patient to bite on these wax blocks, and that helps record our bite. Another thing we need to be aware of is as people lose more teeth, their overlap gets more and more. Okay, so you can see that's happening here. And this isn't the most extreme case. We've got more extreme cases where the patient's lower teeth are touching the upper gum. And basically what's happening is as the teeth are being lost, the other teeth are kind of jiggling and moving. And this distance between the nose and the chin gets shorter and shorter. We call this the lower face height. So when we are rebuilding a full set of teeth, it's not just the teeth and the smile, that's all important, but we try and restore this lower face height because, again, that rejuvenates someone. Okay, it makes wrinkles less deep. I mean, that's not the reason we do it. We want to get that lower face height and the upper face height roughly correct so it doesn't look weird, so it just looks like this patient was born with really nice teeth and they've still got them. Okay, that's what our goal is. So once I've done the kind of the aesthetic planning on here, we'll move to our CT scan. Okay, so we can see the CT scan here. What I'm going to do, I'm just going to remove the implants. I won't go into planning the implants in too much detail, but here we've got a kind of an overview of what the upper jaw and the lower jaw is like. Okay, we've got bone from here to here. We've actually got loads of bone in this case. We've got a sinus here, we've got a sinus here. These are areas we want to avoid. And these, if I move this here, you can see things are moving. Okay, these three vertical lines is, if we were to cut this scan in these lines, you get these three images here. Okay, all the slices. And then if we were to cut in the blue, where the blue line is, you get this view up here. Okay, so we know that from our aesthetic planning, we need to take the gum higher by 6 millimeters. Okay, so what we do is we look here, okay, and I know that there's an implant's going to go roughly in that position. Okay, so I can see on the slice here, if I take a measurement of 6 millimeters, we're there, you know, just shy of 6 millimeters there. Okay, and that position is roughly, and when I take this tooth out here, the base of where that root is, that's where I need to go to. Okay, but also we've got surgical rulers. I can measure 6 millimeters in the patient's mouth, and I know that if I take off that amount of bone, then aesthetically we're going to have a good outcome. So I measure it at the front, but also measure it at the back. Okay, at the back we usually have much less bone because we've got these air sinuses. So you can see here we've got this air sinus. If we were to take these teeth out, we don't have much bone in that area there, right? If we were to measure it, you got 3 millimeters until you get to the air sinus. So we can't take the full 6 millimeters off there, but we don't need to. Okay, if we go back to the smiling photo, you can see that you can never even see the gum back there. Okay, so we don't need to take 6 millimeters off there. The important figure is to take it off at the front, see how many teeth we need to take that off, and then we kind of blend it into the bone level at the back. Okay, so all those people who've been told you can't have implants because you've not got enough bone, when we're doing a full set, it's pretty weird to see that we actually take away more bone. Now, the reason for this is if you're replacing 1 or 2 teeth, okay, the position you put your implant in is completely different to if you're replacing a full set of teeth. Okay, I have touched on this subject before. It's a little bit complicated. I might make another video about it in the future. Now, at the top, the planning is actually not too complicated, especially in this case. We do have loads of bone. Okay, if we didn't have a lot of bone, there's more complicated implants we can start looking at. Okay, but let's keep it simple because I'd say 70 to 80% of cases are relatively straightforward. We've got enough bone. Now, if we look at the bottom, okay, at the bottom we've got different challenges. Okay, we've still got quite a lot of bone in this case. I'm just going to redraw this, we call it the panoramic curve. Okay, it just makes this picture a bit clearer. Now, can you see these little yellow bits here? Okay, these help me visualize where the nerve on the lower jaw is. Okay, so we've all got these nerves. They come out roughly at the corner of the mouth in the middle here somewhere. Okay, and if you've been numbed up for a tooth filling or anything like that and your whole lower lip feels numb, this is the nerve that's been targeted by that anesthetic. Okay, now we obviously don't want to damage this nerve. This could give either long-term or permanent numbness to somebody's lip. Okay, luckily it's not what you call motor. It shouldn't really affect the smiling and movement, but it definitely affects the sensation. Okay, so our safe zone is really in between these, where the nerve comes out. Now, on the lower jaw, the quality of the bone, the density is much better. So typically, we don't have a problem with not enough bone. Okay, there are some situations where we genuinely don't have enough bone, but they are so rare. I have seen them, but hardly ever. Maybe once or twice in the last 10 years I've been doing this. Okay, so again, we'll just create a slice. We can see that in cross section, and we measure it. Front to back, 8 millimeters. That's loads and loads of bone. And height, we can go like 20 millimeters if we want to. Okay, I never, not for this situation. We'd never use an implant that long for this situation, or I wouldn't. I just don't see the point. So on this software, we can actually now position our implants, okay? And all these implants have different characteristics. The angled ones have something called a coaxis. The straight ones, all different sizes that we've got, different widths, different lengths, and we choose the most appropriate implant for each and every site, okay? So we've gone for a standard 4 at the top, 4 at the bottom here. Okay, now one thing I didn't mention, which is really important in the planning, is how far back the last implant comes out. Okay, so you can see in this situation, it's coming out roughly at the first big tooth, okay, the first molar tooth. And that's a little bit unusual because usually there isn't enough bone and it comes out in tooth number 5 position, which is the one in front of it. Now, when we are planning from here, we need to look, our last tooth is going to be this one here. And that's fine because this lady's not smiling that far back. But if we could see that our implant's only going to come out in this position and the patient is smiling more widely than that, then we need to look at other implants, and it's usually something called a pterygoid implant, which goes really far back. Okay, so all of these things are kind of taken into account. Then I've got a list of all the implants that I'm likely to need on the day. And I've got a kind of a plan in my head. Before the surgery, I will go through this CT scan, early in the morning. Again, it just helps me visualize what I'm going to find when we start doing the treatment. So there's just no surprises. It's just something that I typically do, okay? But it really helps me just to refresh my mind because I see so many of these scans. I want to have only one person's scan in my head for the day that we do something like this. Now you can see that we've planned an upper and lower implant case here. So if it was just an upper, usually I would have a removable denture made, sent to me, and we put the implants in, and then I can do what we call a conversion, turning that into a temporary set of teeth. If we do top and bottom, I'll usually ask the lab technician to come in because as soon as, while I'm finishing off the implants at the top, they can start doing the conversion for the top teeth. I can put the lower teeth in and the lower teeth conversion can be done. It's a little bit more efficient on time. But as a patient, if you were having this done, we would aim, if it was just a top set of teeth, to be done maybe 1, 2 o'clock. If we were doing top and bottom, maybe 3, 4 o'clock, something in that kind of ballpark. Okay, so I hope you found this interesting, right? It's part of a 3-video mini series that I'm putting together. Next, we're going to start looking at what happens on the day of surgery, okay? The behind the scenes, the stuff which you wouldn't probably realize, and the way we make the treatment as comfortable as possible, okay? It's not the nicest thing to have. Everybody is nervous on the day of treatment, okay? It's like going on a roller coaster when that roller coaster is just clicking, 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 taking you higher and higher and higher, okay? I hate roller coasters, right? But it's that feeling. And once you've been around the roller coaster, you're like, whoa, okay, that's wasn't as bad as I was thinking, okay? So everybody's nervous on the day of treatment. There is so much that we do to try and minimize our complications, keep our treatment down to a minimum. and to try and get the best results we possibly can. Okay, so yeah, in the next video we'll go through all of that, and in our third video, which might end up being 2 videos, so there might be 4 in total, I'm having an interview with one of the labs that I use for this full arch stuff. We're going to talk about the materials we're using, why we use those, how the materials have evolved. The materials I'm using today are not the materials I was using 3 years ago, and what's on the horizon, okay? Because there's some really cool stuff out there, ways that we can actually make the treatment more cost effective, ultimately cheaper for our patients. And, if more people have access to this treatment, it is life-changing and it's super expensive. If we can bring the costs down and still maintain high quality, I think that's a really, really cool thing. Okay, so subscribe, join me for those videos, and I will see you soon. Take care.